How do embryonic stem cells differ from adult stem cells? Imagine the building blocks of life, each with its own story and purpose. Today, we're exploring how two types of stem cells, embryonic and adult, differ in their origins, abilities, and ethical considerations. Embryonic stem cells come from very early-stage embryos called blastocysts, which are about 3 to 5 days old. These cells are called pluripotent, meaning they can turn into almost any cell in the body. That's because they have the potential to develop into all tissues and organs, making them highly useful for research and regenerative medicine. But obtaining these cells involves destroying the embryo, which raises ethical questions about whether it's right to end a potential human life. This concern influences laws and policies around embryonic stem cell research. Adult stem cells are found in mature tissues like bone marrow, skin, fat, and the brain. These cells are called multipotent because they can only develop into a limited range of related cell types. For example, stem cells in bone marrow can produce different kinds of blood cells but cannot turn into brain or muscle cells. These cells naturally help repair and maintain tissues in the body. Since they are taken from living tissues without harming the donor or destroying an embryo, their use generally faces fewer ethical issues. From a medical ethics point of view, adult stem cells are often preferred because they avoid the moral dilemmas linked to embryo destruction. However, they are less versatile than embryonic stem cells, which limits their use in some treatments. To overcome this, scientists have developed induced pluripotent stem cells, or iPSCs. These are adult cells reprogrammed to behave like embryonic stem cells, offering a way to get the best of both worlds, broad potential and fewer ethical concerns. In summary, embryonic stem cells come from early embryos and can become nearly any cell type, while adult stem cells come from mature tissues and have a more limited range. The ethical issues surrounding embryonic stem cells stem from their source, whereas adult stem cells are generally seen as more acceptable because they don't involve embryo destruction. Both types have their roles in medicine, but understanding their differences helps guide ethical decisions and research directions.